One of the biggest myths about childhood is that it is a stress-free time full of rainbows and unicorns. But the reality is that even under the best of circumstances, growing up takes work, and stress from school, friends, and parents takes a toll. Coping with a mental illness causes all kinds of additional stress that can cause real and lasting damage. You're probably watching this video right now because there's a child in your life whose struggles seem bigger and scarier than the ones you've seen in the past. You're wondering what's wrong and how you can help. Well, you've come to the right place. Early diagnosis and intervention is essential for the successful treatment of severe mental illnesses. But there are added obstacles for kids. For one, most mental disorders don't have a separate diagnosis established for kids, and the adult version usually looks different with different symptoms. Toughest of all is that for some kids who are struggling the most, doctors and therapists don't know what their disorder is because its name and treatment is brand new. For kids with bipolar disorder, there's a brand new diagnosis that appears in about 1/3 of bipolar patients. It's called Thermoregulatory fear of harm mood disorder, or fear of harm for short. And while it sounds scary, the exciting part of this diagnosis is that even though kids who have it struggle desperately with fear, aggression, nightmares, sleeplessness, mania, and depression, fear of harm has a solution. There's a treatment that works to stop the symptoms dead in their tracks and helps give kids and their families the tools to recover and rebuild. You might be wondering how to tell if someone has fear of harm. The proposed diagnostic criteria lists 7 total symptoms to look for, but the first 5 are the easiest to observe. Rapid and unexpected mood swings, with feelings of depression and worthlessness swinging to mania with racing thoughts and back and forth throughout the day. Huge fears that they or someone they love might be harmed, and seeing threats around them when they don't really exist. Feeling hot, excessive sweating, or overheating while in normal room temperature environments. Experiencing heat buildup in the body from stress, and having body temperatures rise at bedtime when they should be dipping, and staying low in the morning when they should be rising, both of which disrupt sleep. Being aggressive or oppositional with tantrums and destructive behaviors not appropriate for their age. Difficulty falling asleep, difficulty staying asleep, difficulty waking in the morning, nightmares and night terrors with horrifying images. Now, we all might feel some of these things from time to time, but for kids with fear of harm, they experience these things when the environment doesn't call for it. Also, they experience them so intensely that they become obstacles to living their daily lives normally and cause them and their loved ones a lot of distress. And the likelihood of having fear of harm increases if the child has a family member with a mood disorder as well. But the most telltale sign of fear of harm is something you'd probably never think to connect to mental health problems. It's that third symptom, being hot. In fear of harm patients, their bodies can't regulate temperature properly, which means these kids run hot. So hot, in fact, that their ears get bright red and are even warm or hot to the touch. This buildup of unreleased body heat leads to behavioral problems such as aggression, defensiveness, hostility, intense fear, and a misperception about the level of threat in their environment. All this happens because the part of the brain that controls body temperature is related to the part of the brain that controls the fight or flight instinct. And when the body can't regulate its temperature, its fight or flight instinct goes on the fritz too. So what do we do about it? Well, the researchers who identified fear of harm also identified a treatment that works. Once the bipolar symptoms are under control with traditional medications, an additional medication is added that specifically targets the body's temperature controls, helping the body to release its pent-up heat and to increase the body's ability to thermoregulate. This leads to less fear, less aggression, fewer nightmares, and a significantly improved quality of life, putting the patient and family on the path to recovery. If you think that you or someone you know is suffering from fear of harm and needs help, come check out what we do. Reach out. Let us know where you are and how we can help. Because with the right information, you too can get an accurate diagnosis, a treatment plan that works, and find hope.